Greetings and welcome to another lecture on the personality disorders. Now, what this particular lecture is going to be concerning is treatment of these disorders and outcomes. Basically, ways to treat personality disorders and hopefully what will happen once they are indeed treated. All of this starts out with a very, very large caveat, which is these disorders are really hard to treat. They are. There's two big reasons for this. Well, there's three possibly, because the third is they're so vague that it's difficult to tell whether it's a disorder or not in a lot of cases. But the first is, by definition, they're inflexible and long-lasting. By definition, they don't change and they're chronic, which basically means that trying to treat them is going to be difficult anyway, because by definition, they don't change and they last a long time. But the other problem, the big problem, is that most people with these disorders, with a couple of exceptions, something along the lines of, a couple of exceptions, people see nothing wrong with themselves when they have these personality disorders. The problem is not them. The problem is other people, right? Or the problem is them, but there's not a damn thing that they can do about it. There's nothing they can change. They are worthless, they are terrible, they are hopeless, and so therefore it's up to other people to save them. So, as you can imagine, people aren't going to be trying really, really hard to help themselves when this is what they're feeling. They're not exactly going to be, busting their buns in order to fix this. So, the one personality disorder that there's been quite a bit of treatment of, and at least some success with, is borderline. Borderline personality disorder, like I said, has been a big thing for 10, 15, 20 years, and there have been lots of different ways, treatments that people have been using to try to treat this. The first is what's called dialectical behavior therapy. And dialectical behavior therapy is essentially getting people to understand that just because they're not perfect, that just because they feel bad doesn't mean the world is ending. Okay? Just because they feel insecure doesn't mean that they have to hold on to people so tightly that people tend to run away in fear. Just because of how they feel doesn't mean they have to cut themselves. Just because of how they feel doesn't mean that they have to be, horribly angry at people and push them away while at the same time trying to pull them closer. In a way, this is like systematic desensitization for phobias. That you get people used to having these feelings and dealing with these feelings without going into the really maladaptive behavior of borderline personality disorder. And this has indeed shown some success to try to change the way that people think. There's also on the Freudian end of the spectrum, and yes, when I say Freudian end of the spectrum, you can and should go, At the Freudian end of the spectrum, we have transference-focused psychotherapy. Now, if you remember what transference is, according to Freud, transference is when the patient transfers the feelings that they have toward important people in their lives toward the therapist, so then the patient and therapist can work it out. Yes, it's very psychodynamic. And the idea here is that what we're going to do is we're going to strengthen people's weak egos. Remember, according to Freud, the ego is the part of the personality that deals with the real world. It has to deal with both the id and the superego, and it basically has to live in the real world. And so the hope is to strengthen the ego so that it stays away from the kind of all or none things you see from the superego or from the id, particularly the superego. Which, if Freud is correct, may well be correct, but like I say, we go, I suspect it works for some. There's also what's called mentalization. And mentalization is helping people develop skills. A lot of therapy is about helping people develop skills. The idea being that it allows them, therefore, to understand feelings and emotions in themselves, to not overreact, to not underreact, to not freak out, and also to help them understand emotions and feelings in other people. To understand, for instance, that you're constantly testing people is not going to help your relationship with them. To understand that clinging so tightly to someone that you might as well be their conjoined twin is not going to make that person stick around longer, and in fact may do the opposite. So in a way, it's helping people think more clearly and more coherently and more realistically about how they are doing. Lastly, we have the biological treatments. Now, one would think that if serotonin may be involved here, that one way in order to treat people with borderline personality disorder would be to increase the amount of serotonin, to give them the SSRIs, to give them other sort of serotonergic drugs. The problem is that it doesn't work, at least not for people with borderline. It may work for people with other personality disorders, but when it comes to borderline personality disorder, antidepressants do not help the borderline personality disorder. Now, I suppose it could help the BPD if it's a product of an underlying depression. You treat the depression, the BPD goes away, but for borderline itself, no, unfortunately, these don't really tend to work. And that's the high point in treating personality disorders. That's the high water mark, y'all. Because basically what we're talking about other disorders, when it comes to paranoid, schizoid, narcissistic, or histrionic, we got nothing. We got nothing. I mean, we got possibilities. We got things that may work for an individual or they may not. But in terms of good, tried and true replicated therapies, we basically got nothing. Okay. Now, cognitive behavioral therapy might help for people with dependent and avoidant, as may psychodynamic therapy. So with dependent and avoidant personality disorder, there is basically hope. And I would also argue that dependent and avoidant are some of the people that are least split from reality. You know, we have dependent who may simply need to be taught how to take care of themselves. We have avoidant who may simply need to be reassured that, you know, other people don't hate them and that they can learn social skills to allow them to be out in the real world. So that might work. But for the rest of the personality disorders, it's like, yeah. By the way, for avoidant, in terms of the whole thinking that, you know, no one wants to be around you and extreme social anxiety, that sort of thing. In that case, SSRIs might help. In that case, it might help to take a serotonergic drug to increase serotonin. But yeah, I mean, when it comes to personality disorders, it's just a whole big pile of vagueness. We're not exactly sure where they are, what the lines are that divide them. We don't have any really good treatment. We're not exactly sure how common they are, and they're really difficult to treat. So yeah, it's not a fun thing. But we do what we can, and for the last lecture or lectures, I'm going to be talking about kind of a subset of the personality disorders, psychopathology.